All right, today is September 7th. We are continuing with chapter 2, which is a really long chapter. So, like I said in my post in the Google Classroom, please bear with me. I thought we would be on Google Meet where I would be reading this, but either way, I have to read it. So, I'm going to try and get through as much of it, if not all of it, today. And I did post the exercise answers, so you guys have those as well. Okay, we are on page 46, musculoskeletal system. The musculoskeletal system is a system of muscles, joints, tendons, and ligaments providing movement, form, strength, and protection. Various muscle and bone types work together in this body system. Bones. Bones are comprised of rigid connective tissue and provide the following functions: form the skeleton, provide the chief means of support for the body, provide the mechanism for motion, protect vital organs, serve as a production factory for blood cells, for example, marrow, store calcium, phosphorus, and magnesium salts. Bones classified according to shape are long, bones longer than they are wide and found in the limbs. Example, femur and humerus. These bones are named for their elongated shape, not their size. Tubular, long bones. Short, roughly cube-shaped bones such as carpal bones of the wrist and tarsal bones of the ankle. Sesamoid, a short bone shaped like a sesame seed, formed within tendons, cartilaginous in early life and osseous, bony in the adult. The patella is the largest sesamoid bone in the body. Cuboidal, short bones. Flat, consists of layer of spongy bone between two thin layers of compact bone. Cross section is flat, not rounded. Flat bones have narrow but lack a bone marrow cavity. Skull and ribs are examples. Irregular, these are bones in the body not fitting into the above categories mentioned. Several are found in the face, such as the zygoma and mandible. Vertebrae are irregular bones. Cartilage and joints. Cartilage is a type of flexible connective tissue that is non-vascular, has no blood vessels. Cartilage is a matrix made of chondrites, collagen, and glycosylated protein called proteoglycans, depending on the type of cartilage. Joints and articulating surfaces are synonymous and provide a connection between two or more parts of the skeleton. Joints are classified according to the type of connective tissue at the articulating surfaces. There are three types: fibrous, cartilaginous, and synovial. Most joints are synovial and have the following characteristics: articular cartilage that covers the bone ends, joint cavity lined with a synovial membrane which secretes a thick, viscid, slippery mucus that cushions the joint and allow smooth motion. Joint capsule of fibrous connective tissue that surrounds and provides stability of the joint. Accessory ligaments that give reinforcement. Human skeleton. The human skeleton is divided into two parts, the axial and the appendicular skeleton. Axial skeleton includes skull, hyoid, ribs, sternum, vertebrae, sacrum. Appendicular skeleton includes shoulder girdle, pelvic girdle, extremities. And then we have two diagrams showing you both the axial and appendicular skeleton. Common bone fractures. Closed fracture does not involve a break in the skin. Compound fracture projects through the skin with the possibility of infection. Comminuted fracture, more than two separate bone components, fragments. Transverse fracture, break shaft of a bone across the longitudinal axis. Green stick fracture, only one side of shaft is broken and the other is bent, common in children. Spiral fracture, spread along length of bone and produced by twisting stress. Colles fracture occurs in wrist and affects the distal radius bone. Compression fracture, vertebrae collapse due to trauma, tumor, or osteoporosis. Epiphyseal fracture occurs when matrix is calcifying and chondrocytes are dying, usually seen in children. Understanding the type of fracture is essential to proper diagnosis and procedure coding. An example of this can be seen when coding a compound fracture. A compound fracture is coded as an open fracture. Muscles. Muscles have the property of contractility. They also provide form and produce heat for the body. There are three types of muscles found in the body: skeletal muscle, also called striated muscle, and is attached to the skeleton by tendons. Contraction of skeletal muscle is under voluntary control. Cardiac muscle, also called heart muscle, and contains interlocking involuntary striated muscle, which allows the electrical impulses to pass quickly across the muscle fibers. Smooth muscle, found in the walls of all the hollow organs of the body except the heart. Its contraction reduces the size of these structures. Movement generally is involuntary, not under voluntary control. Medical terms related to musculoskeletal system: ankylosis, condition of stiffening of a joint; arthralgia, pain in joint; arthritis, inflammation of a joint; arthrodesis, surgical fixation of a joint; arthropathy, joint disease; bursitis, inflammation of a bursa; carpal, pertaining to the wrist bones; chondral, pertaining to cartilage; chondralgia, pain around and in the cartilage; coccygeal, pertaining to the coccyx; connective, tissue connecting or binding together; dactylic, pertaining to finger or toe; femoral, pertaining to femur, thigh bone; iliac, pertaining to the ilium; kyphosis, abnormal curvature of thoracic spine, humpback; lordosis, abnormal anterior curvature of spine, usually lumbar, swayback or hollowback; metacarpal, long bones of the hand that form the skeletal structure of the palm; osteoblast, bone forming cell; osteocarcinoma, cancerous tumor of bone; osteochondritis, inflammation of bone and cartilage; osteopenia, lower than average bone density, can be a precursor to osteoporosis. Osteoporosis, condition resulting in reduction of bone mass; osteopathy, structure of bone; patellar, pertaining to patella; phalanges, bones of the fingers and toes; scoliosis, lateral curvature of spine; sternotomy, surgical incision of sternum; tarsal, pertaining to the tarsal bones in the foot; tendinitis, inflammation of a tendon. In CPT, the section containing the 20,000 code series pertains primarily to the musculoskeletal system and is arranged by anatomical regions and structures. Now we have 2.3, and I figure I'm just going to tell you guys the answers in the recording. That way you can just get them and keep going and not have to go back to the Google Classroom to get them. I'll just put them in here, and that way I know that you listen to these recordings, because this is hard work. All right, 2.3 answers are: number 1 is D, green stick fracture; number 2 is B, pelvic girdle; number 3 is A, metacarpals; number 4 is C, synovial; number 5 is A, arthro. Moving right along to the cardiovascular system, my favorite. This system is comprised of the heart and the blood vessels working together to move blood throughout the body. Blood provides nutrients and oxygen to all organs and tissues within the body. Blood vessels. There are 3 types of blood vessels: arteries, veins, and capillaries. Arteries carry blood away from the heart. They often are colored red in anatomical drawings to depict the red color of oxygenated blood. All arteries leaving the heart carry oxygenated blood except the pulmonary arteries. The pulmonary arteries carry deoxygenated blood from the right side of the heart to the lungs. The arteries get smaller as they go out into the extremities, turning into arterioles and eventually comprising the arterial side of the capillary bed. The venous side of the circulation begins in the venous side of the capillary bed, enlarging to form venules and eventually forming veins. Most veins bring deoxygenated blood, which is dark red in color, back to the heart. Veins often are depicted in illustrations as blue because the dark red color with skin over top gives a blue appearance. It is not actually blue. Veins take deoxygenated blood back to the heart, except for pulmonary veins, which carry oxygenated blood from the pulmonary veins to the left side of the heart. Capillaries are tiny vessels, usually a single cell layer thick. They are semi-permeable and facilitate the exchange of fluids, oxygen, nutrients, and waste between local tissues and the bloodstream. Heart. The adult heart is approximately the size of the human fist and usually weighs less than 1 pound. The heart pumps blood to two distinct systems for circulation. The first system is pulmonary circulation, receiving deoxygenated blood into the right atrium from the superior and inferior vena cava. The blood then flows into the right ventricle and is pushed into pulmonary circulation via the pulmonary trunk, which divides into the right and left pulmonary arteries. Blood circulates through the pulmonary vascular tree in the lungs and into the left atrium of the heart through the right and left pulmonary veins. The left side of the heart pumps oxygenated blood to the systemic circulation system via the left ventricle to the aorta. Because the left side of the heart is responsible for pumping blood throughout the entire body, the muscle surrounding the left ventricle is stronger and larger than the muscle of the right ventricle. Blood flow list. Right side of the heart, number 1, veins deliver deoxygenated blood into the superior and inferior vena cava. 2, this blood empties into the right atrium. As the right atrium contracts, blood flows from the right atrium into the right ventricle through the open tricuspid valve. 3, when the right ventricle is full, the tricuspid valve closes, preventing blood from flowing backward into the right atrium. Number 4, as the right ventricle contracts, blood leaves the heart through the pulmonic valve and flows into the pulmonary artery, which bifurcates into the right and left pulmonary arteries and into the lungs, where it is oxygenated. This oxygenated blood then returns to the heart through the pulmonary veins. Left side of the heart, number 1, the pulmonary veins take oxygen-rich blood from the lungs into the left atrium. Number 2, as the left atrium contracts, blood flows into the left ventricle through the open mitral bicuspid valve. 3, when the left ventricle is full, the mitral valve closes, preventing blood from flowing backward into the left atrium. Number 4, as the left ventricle contracts, oxygenated blood leaves the heart through the aortic valve and flows into the aorta to supply the body and into the coronary arteries to supply the heart. The heart is composed of 3 layers, epicardium, myocardium, and endocardium, and is enclosed in a double wall lining called the pericardial sac. The pericardial sac prevents the heart from rubbing against other organs or body structures as it beats. The epicardium is the outer layer of the heart. The main muscle of the heart is the myocardium. Myo means muscle, cardi means heart. Myocardial tissues allow electrical impulses to pass quickly across muscle fibers as part of the heart's unique electrical conduction system. The inner lining of the heart is the endocardium. And then you have a picture of the interior of the heart. You also have this picture, of course, in your coding book. So if you need to add any words or prefixes, suffixes, or roots, I would add them there on my picture for easy access. Medical terms related to the cardiovascular system. Angina, relating to spasmodic attacks of suffocating pain as related to an inflammatory condition of throat or mouth, or angina pectoris. This is marked by chest pain due to deficient oxygenation of the heart muscle. Angiocarditis is inflammation of heart and vessels. Angioplasty, surgical repair of vessels. Arteriosclerosis, hardening of an artery. Arteriotomy, incision into an artery. Atherosclerosis, a type of arteriosclerosis characterized by lipid deposits causing fibrosis and calcification. Bradycardia, slow heartbeat. Cardiocentesis, surgical puncture of the heart. Cardiologist, a physician specializing in diseases of the heart. Cardiomegaly, enlargement of the heart. Cardiopulmonary, pertaining to heart and lungs. Carditis, inflammation of the heart. Cyanosis is bluing of skin and mucous membranes caused by oxygen deficiency. Diastole, relaxation of the heart, allowing blood to refill the heart chambers. Electrocardiogram, electrical tracing of the heart and heart muscle activity. Embolism, blood clot traveling through a blood vessel to another part of the body. Hemangioma is a benign tumor of a blood vessel. Hypertension is persistent, excessive pressure in the arteries. Pacemaker, a system that uses low energy electronic pulses to control the heart rhythm. Pericarditis, inflammation of the pericardium. Systole, contraction of the heart. Thrombus, blood clot formed within a blood vessel. Transluminal, passing through a tubular organ or part, such as the lumen of a blood vessel. Understand standard medical abbreviations used in the medical records documentation. In the cardiovascular section, physicians often dictate using medical abbreviations to indicate the artery or vein involved. Application to documentation. The LAD was then dissected out, arteriotomy was performed, and the IMA was anastomosed in the end-to-side fashion to the LAD using running 7-O-proline around the heel of the anastomosis. The toe of the anastomosis was closed using interrupted 7-O-proline. Rewarming was begun during this anastomosis. The IMA pedicle clamp was released. Rapid resuscitation of the heart was seen, as well as rapid distal filling of the LAD. The IMA pedicle was affixed to the epicardium using 5-O silk suture. The aortic cross clamp was removed. A partial occlusion clamp was placed on the aorta, and 3 punch arteriotomies were made on the aorta. The vein grafts were measured to length, cut, and spatulated, and anastomosed in an end-to-side fashion to the aorta using running 6-O-proline. All 3 proximal vein graft anastomoses were marked with titanium clips. The most distal graft on the aorta is to the posterior lateral branch of the circumflex, more proximal to the ramus, and the vein graft to the PDA was brought to the right side of the aorta. Partial occlusion clamp was removed. In the documentation above, IMA indicates internal mammary artery. LAD indicates the left anterior descending artery, and PDA indicates the posterior descending artery. CPT codes 33016 through 37799 address surgical procedures to the cardiovascular system. CPT codes 92930 through 92979 address therapeutic services and procedures to the cardiovascular system. Now we have 2.4. For section review 2.4, the answers are: number 1 is C, inferior and superior vena cava. 2, answer is B, left and right pulmonary veins. 3 is C, angiocarditis. 4 is B, endocardium. And finally, 5 is B, oxygen deficiency. All right, I'm going to stop, and then I'm going to continue with the next system, which is the lymphatic system.